Telehealth is not a new concept, but the realities of operating in a post-COVID world mean limited face-to-face interactions and reducing exposure to risk for our staff and our patients. One of the biggest barriers to telemedicine is finding an affordable, HIPAA-compliant tool that's both easy to use and fully integrated with your existing EMR. With the Add Telehealth platform, you have the opportunity to boost revenue, see more patients, and offer a branded experience in a virtual world. Virtual appointments allow providers to do free consultations without taking up valuable time on your in-clinic schedule. These visits are also a great way to perform good faith exams prior to the appointment. Telehealth provides your practice with a way to meet the needs of more patients without time or geographical barriers. Since patients can do a virtual consult from anywhere, taking time off to come into the practice is no longer an issue, and providers can continue to counsel clients during off hours when your physical location is closed. For clinics with private label or busy skincare businesses, your virtual clinic gives you access to patients both near and far. Without geographical barriers, your team can consult, recommend, and ship out skincare to patients who might otherwise seek a local provider or an online store if your option didn't exist. For surgeons, it can be challenging to schedule with out-of-town patients. Some might be reluctant to book knowing they have to come back in later on. However, a virtual consult can help to not only convince them that you're the right surgeon, but also convert that patient. It can be a gift to patients trying to arrange their schedule to travel multiple times after the surgery is complete. Not all telehealth options are created the same. It's important to use a HIPAA-compliant telehealth system so that both the patient and the practice are protected. Things like FaceTime or Zoom are not intended nor secure enough to ensure patient information is protected. This opens your practice up to unnecessary risk and can end up causing a lot of problems down the road. Your system also has to be easy. If patients and providers cannot jump on a virtual visit at any time or anywhere without a lot of hassle, you might find yourself missing out on the overall benefit of a virtual clinic. Lastly, it needs to be part of your clinic's existing workflow. When patients book a virtual visit, the process should flow just like it flows in an in-person visit. You need an appointment reminder, a check-in procedure, charting functionality, and the ability to pre-sell and pre-book procedures. If your EMR and your telehealth system are not connected, you may find that telehealth creates more of a headache for your staff than it actually helps them. Our AR platform treats a virtual visit in the exact same way as an in-office visit. Patient confirmation emails contain a join link, and providers can enter the virtual clinic right from their schedule. They can chart notes, they can do procedures, prepayments, and retail skincare all from the same place, housed in the same system that you use every day. And best of all, it's all part of your AR subscription, so there are no additional fees to begin using it. Make telehealth a competitive advantage for your practice in a way to engage patients and create a memorable experience that exceeds your expectations.